I had the opportunity to present work that summarized some of the findings coming out of the ASH-RC COVID-19 Registry for Hematology, and specifically some of the data coming out of the malignant portion of that registry. And really, before we talk about some of the findings, I think one of the important things for me to highlight is how unique that registry is. So this is a volunteer registry that presents cross-sectional data from around the world, and it's a public-facing registry. So we are updating data very frequently, and it's available on the web for anyone who would like to see it and really see how things are evolving with the COVID-19 pandemic among our patients with blood cancer. So what we had the opportunity to present was findings on the first 1,029 malignant cases in this registry. And we presented some summary findings from that data. And I think one of the most important findings really reinforces the reports from many other centers that patients with blood cancer do experience a significant risk of mortality from COVID-19. And the estimate that we had in our data set was a 17% risk of mortality across all the patients in the registry. And it's not a comparative registry. It's only of patients who have blood cancer and COVID-19. But if we were to compare this number to numbers that have been reported in the general population from other countries, it's significantly higher than those numbers. So in the United States, for instance, mortality has been estimated as anywhere from 1.6 to 6.2% at different times in the pandemic. So I think that's a really important thing to highlight. It's very consistent with the findings of others. And I think it's especially important for all of us who are clinicians right now, as we see COVID spreading yet again with Omicron, to know that our patients likely, certainly they've been more vulnerable to previous variants, and we don't know if they'll be more vulnerable to this new variant, but there's certainly cause for concern. So that would be really one of the main findings. Other findings that we reported, we were able to do multivariable analysis and try to see if we could identify certain groups of patients who had higher risks of poor outcomes with COVID-19. And in particular, we found that older patients, again, this is very consistent with what's been reported by others in blood cancer patients and even in the general population. So patients over age 60 had worse outcomes. Male patients, interestingly, and this has been increasingly reported by others as well, that for some reason male sex seems to be a risk factor for worse outcomes of COVID-19. And then I think the two variables that we looked at that were unique to this registry, or that came out and that are unique, we asked clinicians to estimate the pre-COVID prognosis of patients. So trying to really focus in on those sickest of patients with blood cancer. And we found that patients whom their clinician estimated had a prognosis of less than 6 months prior to COVID-19 did have more serious outcomes. And then we also found that patients who deferred ICU or where ICU was deferred in favor of a palliative approach also had worse outcomes. And then another result that I would highlight is we looked at a number of other variables, many of which were significant in univariable analysis, but were not significant in multivariable analysis. And one of the ones that I was interested in particular was treatment. So cancer treatment in the previous year. This has been a big unanswered question that many people are interested in. Many of us were very concerned about whether or not it would be feasible to treat blood cancer safely in the context of an infectious disease and a worldwide pandemic. And certainly in our data set, treatment in the prior year, although it was associated with an increased risk of hospitalization with COVID-19, it was not associated with an increased risk of dying from COVID-19. And to me, that's a little bit reassuring. And what it tells me is that when someone is presenting with a blood cancer, even though there is a pandemic going on, we really need to focus on offering the best possible treatment that we can for that blood cancer.